You all have probably seen this equipment, but what actually is it? It is known as pulse oximeter and it is used to measure pulse rate and oxygen saturation of body. Oxygen saturation is defined as how much of hemoglobin in the blood is carrying oxygen. The blood carries oxygen to all other organs in our body after oxygenation in lungs, and the main carrier of oxygen in the blood is hemoglobin. Normal oxygen saturation values are ranging between 97% to 99% in a healthy individual. So, a pulse oximeter is a non-invasive medical device which can measure both pulse rate as well as oxygen saturation in a person's blood. Now, moving on to the working principle of pulse oximeter. It is working based on the difference in the light absorption rate of oxygenated and deoxygenated hemoglobin. A pulse oximeter consists of red and infrared LEDs and a photodetector. Oxygenated hemoglobin absorbs more infrared light, whereas deoxygenated hemoglobin absorbs more red light. Oxygen saturation can be calculated as concentration of oxygenated hemoglobin divided by the sum of concentrations of oxygenated hemoglobin and deoxygenated hemoglobin. Now moving on to the operation of pulse oximeter. The finger is placed between the light source and the light detector, and the light which is not absorbed reaches the detector. From the light source, light is emitted which goes through the pulse oximeter probe and it reaches the detector. The amount of light absorbed depends on the following physical properties such as concentration of light absorbing substance, length of light path in absorbing substance. Oxygenated hemoglobin absorbs more infrared light than red light, and deoxygenated hemoglobin absorbs more red light than infrared light. With the help of this ratio, the pulse oximeter does the process of oxygen saturation. There are some errors that can occur while taking measurements in pulse oximeter. That is, due to movement artifacts, accurate values cannot be obtained, and excessive edema or inflammation will also lead to less accurate measurements. So, in order to improve the accuracy while taking the measurement, we can compare and analyze the actual heart rate with the pulse rate value that is shown in the pulse oximeter. It should correlate closely, and in this way we can decrease the errors that is occurring due to the body movements. Now moving on to the types of pulse oximeter. They are transmission pulse oximetry and reflectance pulse oximetry. Transmittance pulse oximetry is the most commonly used one. The light beam is transmitted through a vascular bed and it is detected on the opposite side. And in reflectance pulse oximetry, it is based on light that is backscattered to determine oxygen saturation. Thank you. That's me, Agna. See you in the next video.